Okay, so we've just performed our sectioning video. Same general principles and safety practices. I still have my PPE on. I'm gonna perform hand hygiene and apply clean gloves. I want to perform a respiratory assessment on my patient. I'm gonna go ahead and pre-oxygenate them. Go ahead and open my field here. Going to remove my oxygen. I'm going to remove the old cannula. Typically we would dispose of this, but for this video we're going to pretend like it's sterile, so I'm going to place it in my sterile tray there. I'm going to remove my gloves and perform hand hygiene. I'm going to apply my sterile gloves. We're out of sterile gloves, so we're going to have to improvise here. Okay, so I'm going to apply my peroxide into one part of the tray, lip my saline, and then apply my saline into the other part of the tray. I'm then going to apply my new cannula.
Okay, thank you so much.
And we don't have Q-tips in this kit for some reason, so I would get a Q-tip. I would dip it into my peroxide. I would clean from the stoma out on the top, bottom, and then the sides. With each time I would drop my Q-tip, get a new one, place it into the peroxide, clean from the inside out for each portion of that. And I would get a new Q-tip. I would dip it in my saline. I would then wipe down the faceplate, removing the hydrogen peroxide. I would drop it, get a new one, dip in the saline, and repeat until the faceplate is clean. Then take my 4x4 and I would pat it dry, the faceplate. And then I need my bandage. For this, I would try to remain as sterile as possible when applying it. Okay. I would then apply a new trach collar over top of the old one, being sure not to remove the ties that hold the faceplate secure until I have the new one secured down with the ties, and then I would remove the old one. I would remove my gloves. I would perform hand hygiene, apply new gloves. I would perform a respiratory assessment on the patient. I would then, once I've performed my respiratory assessment, I would then clean up all of my supplies, discarded them. I would then report and record, and that should be it. I would also take off my PPE, dispose of it properly along with my gloves, and perform hand hygiene once again. Then report and record. That should be it.